So I've said a million times that we look to how our social institutions are doing in order to make some distinction or to measure how well a society is doing. Um, every society will have to figure out how to handle these very same challenges all over the world. And we make some determination based on how stable they are is how they sort of answer it. One of those things that we looked at, and we've talked about this elsewhere, that we tend to look at questions like infant mortality, for instance. In general, we tend to look at things like just general health of the people because we need the people to be fine. We need them to live and thrive so that they can make more babies, so that we can, do the things that we need to do. When we're talking about economics and the distribution of resources, well, humans are some of those resources. Like we need the people to be able to do the work, to be able to form the organizations and the families and to handle the functions of a society. So it doesn't always seem like it when we think about things like family and education and governments, for instance, or politics, to think also about medicine. Although when we think about institutions and trying to like really break free that idea of institutions as buildings, the hospital is certainly one of those community institutions that we think about. But usually when we're thinking about these low income or middle income societies. When we talk peripheral and semi-peripheral or old school, we should talk about advanced societies or developing societies. When we are thinking about how well that society is doing, whether or not they have the money to be able to do the things that they need to do, or when we care about when their political structure has become so fractured, one of the things we are thinking about literally is the health of the society. And when we think about social change might happen because of some tragedy, some natural disaster, a pandemic, a hurricane, an earthquake or something. We are obviously initially like immediately thrust into sort of crisis and what is the health of the people, like how are they doing. um Often because of that, when we are paying attention to a particular society and how they're doing, we might be talking about it in terms of when their healthcare has fallen or when there has been sort of a shift in the ability to take care of people. We want to know how they are. We want to know how healthy they are or how sick they are. And in high income societies, for instance, we take for granted things like being in a place with hospitals or being in a place where even you can call 911 or whatever the number is, and an ambulance will come. There's places that don't have ambulances, or they don't have the kind of infrastructure to make sure that an ambulance can get to somebody who's in need. We take for granted that you have healthcare workers. We certainly talk about what it means to have a shortage of nurses in our society, but this is a real big problem. For instance, when we went through the COVID pandemic and we lost a lot of people. And that meant not having as many people as we needed to take care of other people. There were nurses who had to come out of retirement just to somehow manage the issues that we're talking about. Immunizations are always a big conversation in our society, but we take for granted that immunizations are going to be available if you want them. Think about when we created the vaccine for COVID, like who was going to get them first, and where were you going to have the things that you need? Do people have the medicines that they need? Do people have antibiotics when they need them? And the biggest thing that we pay attention to is water. Do people have safe water to drink? Do people have safe water to clean themselves and clean their homes and their dishes and their clothes? So it's a lot about the infrastructure of a society. It's a lot about the resources that a society has physically and monetarily, for instance, just the economics to make sure that people get what they need, and what kind of decisions are being made politically to make sure that people get what they need. Because we care about how the families are doing. We care about how the schools are doing. We care about whether or not the churches are taking care of people. All of these institutions, we always say, they're always connected. And how we understand how well a society is doing, we pay attention to those institutions. So health and medicine is not any different in that case. What is medicine? Medicine is a social institution that aims to prevent, diagnose, and treat illness. A social institution that aims to prevent, diagnose, and treat illness while also promoting health. Illness and health. They're clearly not the same thing, right? But the social institution that aims to prevent, diagnose, and treat illness while also promoting health. The Crash Course Sociology video that talks about this institution defines it as a social institution responsible for treating disease and restoring or improving the health of a population. So now we have this word disease. So we've heard illness, we've heard health, and we heard disease. And so all of those words need to sort of be dealt with. Let's talk about some distinctions first, particularly in this idea of medicine. Again, medicine is a social institution to prevent, diagnose, and treat illness while also promoting health. One of those distinctions that I like to make sure that we make, especially after talking about the economy and making some distinction about capitalism and socialism, it's important to make the distinction between socialized medicine. Is this working today? And universal medicine. I have to recalibrate this pencil because it looks very weird. Socialized medicine is when the government owns and runs the entire healthcare system. Remember when we were talking capitalism versus socialism? In socialism, there's things were state run, these major institutions like this. So when you are a doctor or a nurse or any other staff that is responsible for the care of people in the hospital, for instance, you are then a state employee because the government owns and runs the entire healthcare system. The healthcare system is state run. With universal medicine, you have a system that guarantees healthcare coverage for everyone. It's not the same thing. In a socialized medicine system, the government owns the hospitals, for instance. The workers work for the government. In universal medicine, it's just a question of whether or not people have universal access to healthcare. Healthcare is publicly funded, but the care itself comes from private providers. So if you are a doctor, for instance, if you are a nurse, you might work privately for a hospital, but universally, we are if you have universal medicine, then you are making sure that there is a process or resources that are dedicated to making sure it has coverage, making sure everybody has coverage. In the US, we usually talk about healthcare coverage in two ways, either public or private. And it's the same sort of distinction here. Private healthcare is when we're talking about health insurance that a person buys from a private company. So like you either bought it through the marketplace or you bought it because you're paying for it through your employer, for instance. That's private healthcare. Public healthcare is health insurance that's funded or provided by the government. So when we talk about, again, this question about whether or not we are a capitalist society, and we go back to, well, we are a capitalist society, but there's some things that we won't leave people to take care of themselves. Again, when we're talking about politics as being those questions of, making the decisions about who gets what, when, and how, and answering the question of who has the right to healthcare. And in this case, who's responsible for healthcare? When you have private healthcare, what you're saying is that the person responsible for it is the individual themselves. They're buying their healthcare coverage personally through the marketplace, for instance, or they're paying for it through their employer. If you have public health care, that means that your health insurance is funded or provided by the state or provided by the government. We know that as Medicare, and Medicaid. So Medicare are those health services to people who are over the age of 65 or people who meet other standards for disability. Medicaid are those services to people with very low incomes, or there's another list of other eligibility requirements. And then there's also healthcare that comes through the VA for veterans. There's also a CHIP program, Children's Health Insurance Program, and there's also health insurance through the Bureau of Indian Affairs. The idea is that healthcare, when we talk about rights and responsibilities, we're talking about who has the right um, to healthcare, who has the right to healthcare coverage. In socialized medicine, everybody has the right to healthcare coverage because the state owns it, the state runs it, and everybody gets what they need. What the argument is for universal healthcare is to say we want everybody still to have the right to access healthcare, but in this case, it'll still be mostly privately funded, but the government will sort of step in and make sure that everybody gets it. As it exists right now, under Obamacare, or what we understand as the Affordable Care Act, it is one of our largest sort of methods by which we can have universalized medicine. It's not socialized medicine, it's universalized medicine. And in universalized medicine, you are required then to have health care coverage. You're required to have insurance, either insurance that you buy for yourself through the marketplace or insurance that you buy through your company, right? Those are private healthcare coverages. Or if you're eligible for public healthcare coverages, either through Medicare, through Medicaid, or some other state-run or state-funded government coverage, right? So it's universal medicine. It's not socialized medicine. Our universal medicine has both private and public types of healthcare coverage. Let me go back to this idea because I'm using these words like medicine. I already defined medicine as the institution that is aiming to prevent, diagnose, and treat illness while otherwise promoting health. And I've mentioned this idea of healthcare. Healthcare being just generally the system by which we make sure some insurance that we make sure that people are getting the care that they need, either in a socialized medicine system or universal medicine system. What is health, right? The definition says a social institution that aims to prevent, diagnose, and treat illness while also promoting health. That's what medicine is as a social institution. Why do we separate out health? Health is simply a state of physical, mental, and social well-being. A state of physical, mental, and social well-being. And that is to be distinguished from illness or disease. Disease was when there's a structural or physical dysfunction of the body. We got the word disease from the crash course sociology definition. The social institution responsible for treating disease and for restoring and improving health of a population. Even in that definition, you see there's health and then there's not health. There's illness and then there's health. There's disease and then there's health. Health is simply the state of physical, mental, and social well-being. Disease is when something is wrong. There's a structural or physical dysfunction of the body. When you're talking about diseases, you're talking about a particular set of symptoms that can be that can be objectively measured. And then those measurements or results are compared to some particular profile that we have, right? So if your blood pressure is checked and the number is too high, then we will check sort of our list of blood pressures, what's normal or healthy blood pressures, and determine whether or not your blood pressure is too high, and that makes you sick, or your blood pressure is too low, and that makes you sick. We'll look at things like cell counts, white blood cell counts. This is how many make sense for somebody who has health. This is normal. Or we'll say you have way too many white blood cells. We're looking at some standard because we want to objectively measure it. And if you're off the charts, it's too high or too low, then we'll say that you have an illness, you're sick. Maybe we've decided that there's a disease to be concerned with that. Question is, what are we checking? What are those standards coming from? When we say, I want to check to see whether a person or society is not healthy, I'm checking for disease or illness. Some of those things that we check, you might be familiar with. particularly if you are a psychology student, for instance. But I think even though this is a psychology thing that people are familiar with, I think we're familiar with this in a more casual way. The DSM is the Diagnostic and Statistical Manual on Mental Disorders. When I talk about health, I'm talking about a state of physical, mental, and social well-being. So if I need a listing of mental health illnesses, then I can look in the diagnostic manual, the Diagnostic and Statistic Manual on Mental Disorders. The other thing that I might look at if I'm not talking about mental disorders, I need something about those physical disorders, is I might look at the ICD. The ICD is the International Classification of Diseases. We get this through the World Health Organization. And the World Health Organization has, working with it, 10 international centers, like the United States, for instance, and they come up with these profiles of symptoms and numbers and data and things that say this is what's normal, this is when it's not normal. So this question of where there's illness, or where is health and where's that line of health until we got illness? Where's health and where's that line until we have disease? And so if you look at the DSM, you'll find a list of disorders. If you look in the ICD, you'll find literally a classification of diseases and all of the things that qualify for either of those disorders or diseases. So if a person goes to the doctor and their measurements suggest that they are not on the side of health, they're on the side of illness or disease. We know this because we've got some classification system to look at that. And then when we track back to say, well, what is your medical insurance supposed to cover and sort of treating you? Who's paying for that? That's when we get back to the question of whether that's private health care or public health care, and what is the role of the government of that? Is that a universal health care government system, or do you live in a socialized government system? All of these things are always taking us back to questions of the economy and taking us back to questions of politics. So the last thing that I want to say about that is this question of what is healthy and what is not. All of these things are always connected. It's always going to take us back to our question of economics. How do we make sure that people get the things that they need? It's always going to take us back to our politics. What do we believe in terms of who's making the decisions and managing those resources? How do we get what it is we need? One of those biggest drivers of what we think about what people need and who's responsible for it and who has the right to certain things, sometimes falls right back down to culture, these cultural ideas. You probably have some sense of earlier times in our past, for instance, in our society, but also in other people's society, particularly, and this is why I never like to leave off the DSM, even when I'm talking about sort of physical disease, right? Because we know that mental illness and mental disease is important too. Sometimes we run into conversations that are also then related to religiosity or the institution of religion, because culturally, the question of who is sick sometimes falls down into what we believe God's plan to be, for instance. Some people might believe that the illness that you are presenting is reflective of the path that God has chosen for you. Or there's been times when we've believed that the illness that you are presenting is evidence of your having been smited by God, right? Or because you're participating in behavior that God does not care for you to participate in. That cultural question is really important for a society, because if you do not believe as a society that an illness is related to something that is separate from your spirit, for instance, then you're not going to, as a society, come to the same conclusions about how to treat that illness or whether you should treat that illness. If you've ever thought about this sort of distinction between the mind and the body, that is a relatively new distinction, if you will, in some societies. Rene Descartes a philosopher that we sort of point to as, the person who says, I think, therefore I am. And he did this sort of descriptive thing where he separated himself from everything around him in this philosophical exercise to get to the point where he believed and he argued that the mind and the body and the spirit are separate. In medicine, it's not until we believe or imagine that the spirit and the soul, or the mind and the body, that those things are separate, that we feel like we can actually treat the body without affecting God's plan, for instance. It's a simple thing that we take for granted in the United States culture, for instance. But if you thought that somebody's illness was not separate from their spirit or their soul, then you're certainly not going to then treat them medically, right? Or you're not even going to imagine that there's some things that you have the right to treat. One of my stories or things that I've heard in passing, for instance, and I don't know all the details, but I've heard the story before that Bob Marley had a cancer and chose not to treat his cancer because, as far as he was concerned, he didn't have the right to do those things to the body that God gave him, or to go against what God wanted for him, right? So how you think about that separation between mind and body, any kind of sort of cultural ideas, or what we might think about mental health or mental disease, what we might think about physical health or physical disease, will find itself in those ways that we practice medicine, take care of one another's bodies, and the question of who pays for it, who's responsible for it. There's some things that health insurance companies won't cover, or who's responsible for it in terms of the government. Is it something you should be paying for, or something that they should be paying for? All of these things are always intertwined. So there's a lot more to be said about medicine as a social institution. So I'll do those in the next video.